left mouse button. You see it's active. You press it again, and it disappeared. So right now, on the 3D view, there are no mixture of axiographies. But if it is plus here, we have all the movements that we did, and the names that we gave to them. Do you see that? So remember our art control movement. Let's see how it looks, how we did see it. Yes, we did see it like this. And we can, like if you place control and left mouse button, we can just, for example, do some measurements. Like 41 millimeter of mouth opening, normal range, yes. We can have it for 12 millimeters of lateral protrusion according to the planners, it's also normal range. 11 millimeters, or between 8 and 12 is okay. So it means that this patient does have restrictions in lateral protrusion. It's almost good opening. So if the patient, for example, even had some kind of problems with team D, like closed lock or something. Huh?
This is Dimitris.
No, this is not. This is just a separate patient. With Dimitris, no, this is a separate patient. So if we go to the 3D scene, we see the condyles here, and we see their upper low model. So if we don't have CBCT, or we don't want to use CBCT, we want to have the function like mojo, no more, no less. We can have, so throw them out just a moment. So, what first thing we do? In the models, you can choose transparent mode. You see this actually dots here. That's not a mistake. I do scanning after I use the articulating paper. So I ask the patient to bite, and then I can compare the occlusion that I received on articulating paper with the contacts I see after the scanning.
That's smart.
So that's why you can see how many mistakes are in one and a second, in the first and the second option. This is the patient I told you about with a lawsuit that said that she has, like, if you look here already, you can see this in the mouth, this position. But when she was biting on articulating paper, she was biting because she had something between her teeth. And she was more careful. That's why we see the contacts on the right side, we don't see contacts on the left side. And that actually is her complaint, that she doesn't feel enough support on the left side. So we can do, here it is a box, show contacts. I press it. Actually, when you see red, it's not very good if it will be bright red. It means that during the scanning, there was a problem with the scanning, the teeth like they went into each other. It depends on the quality of scanning, usually. But, well, if you see that before, like you download it.
And sometimes it depends if the patient has periodontic problems.
Absolutely right.
Yeah.
Absolutely right, because patient could just squeeze.
Yeah.
And because there is slight distortion, and if the scan is very sensitive, it will see it like, teeth are penetrating each other. Well, in real world, I work with it, but if you see that before, it's better to do the rescanning and to do it once again. I mean, the scanning and the scanning of the occlusion, because it will take off some of the precision from the work. But this is one point, and actually what I'm thinking about, if I remove the contacts, look, remember where the contact is here, yes? It's second premolar and first premolar. Look here, you see that? That is actually why I think it's very important to be a doctor on the axiography, not to delegate it. Because I'm sure this is for deflecting contacts. I'm sure that when she bites on these teeth, and then something happens with her jaw. So because I see these 2 points, I don't see this point. This might be a mistake in scanning of the occlusion, but that depends on the scanner mostly. For example, in eye terror, I can't give you advice for every scan. In eye terror, you have to be very fast with scanning of the occlusion, and you have to have the minimum distortion of the soft tissues, because otherwise, when the tissues are distorted, gingival margin could be on different position, and that can bring to the mistake in the scanning. But that's not about the system, it's about scanning, most of all. So we bring back the contacts here, and we see the contacts. And right now, what information we can get from here? So as I showed before, that's why I'm showing these cases right now. Let's see this. So I switch off, look, I switch off the eye with the left mouse button, and I leave active only one of the movements. You see the eye is bright, it's dark. Whatever is dark here, it means this is what we are investigating, what we are seeing right now. If it's pale, it means it's switched off from the screen. We don't have it here, we don't see it. So let's see. There is a slider here. You bring it back in the beginning of your movements, and you can see what is going on here from all the sides. So she opens her mouth, she closes, she goes into protrusion, which you already know all these movements. And we can also see, because this is, remember the movements, we don't instruct patient how to do it properly. The only thing we have to follow is that between the movements with the occlusion. So let's see what is going on from the occlusion point of view. She opened her mouth. There was contact here, but it appeared later. You have seen? Once again, contact that appeared later, and not very, I would say, tough contact. So, because I already seen that, look, this is a position I can just find here. For example, we start a movement, she closes, and I think this is my doctor's decision, so I don't have to, I would say, tell you how to do that. It's what the doctor decides when he works with the system. It's his responsibility. For example, it's my responsibility to give this information to the dentist or to the technician. And I tell to the technician, so we have contact here. Yes? Not so tight. I can just maybe squeeze a little bit more. Let's see. Look, I did contacts here on the left side. If I want to do very small corrections, I use the wheel. In that case, the movements will be very small, not with big amplitude. So there are contacts here, and you see this occlusion here. So that's the position I want to use right now. This is the position that I want to ask dental technician